So first question, when and where was the first donor egg IVF done? And how do you think things have changed since then, Professor Laufer?
The first donor eggs to women without ovaries was done in our hospital at Hadassah in Jerusalem in 1986, which resulted in a paper in the New England Journal. And there were dedicated donors whose eggs, fresh eggs, were transferred into the eight recipients whom none had ovaries. And what we found out is that during this experiment we found out, or this treatment, we found out what is the right time to transfer the embryos and what is the right protocol to prepare the uterus. The main changes during the time, the 30 years that passed, involved the uncoupling of the recipient and the donor with the freezing of embryos and eggs, which logistically has made the process much easier and convenient to patients and donors as well.
Great. And on a world scale, what is the practice in donor egg IVF cycles, Professor Laufer?
Recently there was statistics of all the cycles during the last 15 years in Europe, about 15 million such cycles, out of which 5% are donor eggs. And the number of egg donation, or the percentage of egg donation, is increasing because women postpone the age of the first child, and therefore many get to be over 40 without children. And of these, those that are closer to 45 will need egg donation.
Okay. Dr. Safran, is what we do here at Nju Life in any way different to European guidelines and world standards?
We are happy to say that we are implementing at Nju Life a well-established collaboration with a clinic in Ukraine, which works according to international standards in any aspects of the program, including the selection of the donors, their screening before they are recruited, and the protocol used for their stimulation. What it is important to say that we based our cooperation on the use of vitrified oocytes, which are sent here. Some in other places, sometimes it is the frozen embryos that are being sent to the clinic of the recipients.
Okay, great. Professor Laufer, in your experience, what is the average time a patient has to wait for donor oocytes in different countries?
I think that the mean time should be around 3-4 months.
Okay, concise answer, to the point. And again, can a patient choose her oocyte donor, and how much of a choice they have in developed countries?
It varies from country to country. For example, in the United States, you can choose the donor, and in some clinics even to meet the donor. Whereas in countries in Europe and most of other places, the donation is anonymous, so that there is no creation of contact and maybe mental attachment between the donor and the recipient.
Okay, Dr. Safran, what about Nju Life? Would you say our patients have a lot of choice when it comes to...
Yes, I think they do have a lot of choice. We are basically operating according to the Bulgarian law. Whatever the law allows us to reveal, the information the law allows us to reveal for the donor, for the recipients, we do. It includes blood type and the medical history of the donor, her habits, her physical features, and all this information is provided to the recipient, and they can choose from several options that are provided to them.
Okay, good, great. Professor Laufer, what is the world standard for success rates of donor egg IVF cycles?
The success rate for donor eggs should be around 50-55%, and there is a miscarriage rate in the range of about 15 to 20%. So the take-home baby rate from a donor program of one cycle of embryo transfer is in the range of between 40 and 45%.
Okay.
The cumulative, if there is another egg that is one egg or two eggs that can be transferred, the cumulative rate should be around 75%.
Great. And Dr. Safran, how does Nyu Life compare to those rates?
So our program is relatively new. We are operating 1.5 years, and calculating our results through this 1.5 years of operation, we can definitely say that our results are compared with international standards. We only recently calculated our clinical pregnancy rate per transfer to be at the level of about 50%, and the cumulative pregnancy rates to be at the level of 71%.
That's great. And again, to both of you, maybe first the professor would answer, what advice would you give to women who wish to have a child?
The best advice is to have children when their ovarian reserve is such that you can have your own children. But if you miss that time, which is between, let's say, 30 to 40, and one should bear in mind that the option of egg donation exists always as a backup in case a woman cannot conceive with her own eggs.
Okay, and Dr. Safran?
Cannot say it better.
Okay, great. Thank you very much.